If your baby is feeding every 30 minutes over the last 4 to 5 hours and crying continuously asking for feeds, and you started to wonder whether your milk has suddenly disappeared, no, this is the most misunderstood phase of the newborn life. Let me explain. I, Dr. Shilpa, pediatrician from Pune, will let you know why this happens, when it happens, and what you need to do. This is cluster feeding. Short, frequent feeds bunched together is known as cluster feeding. They have a very short interval in between the feeds. This is a pattern, it is not milk insufficiency, so parents do not panic. Let me tell you why this happens. The first reason is a growth spurt. Baby's body demands an increased calorie because there is a development leap. Second is the demand and supply. The baby feeds frequently, give the body the signal to increase the production of the milk. Comforting and soothing. Normally these babies get overstimulated due to the late afternoons or evening. So one method to make them calm and soothe. After the delivery, the maternal body also tries to shift and manage the estrogen and the progesterone. And normally in the late afternoons and the evening, there is slight drop in the hormones that reduces the milk volume and even the fat volume. So that's why at that time the cluster feeding is more often. Neurodevelopment phase. In this, the brain is actively growing, and that's why the baby gets hungrier. So these growth spurts typically happen in the first week of life, that is around 7 to 10 days, then around again 2 to 3 weeks of life, then 6 weeks of life, 3 months and 6 months. So typically during the cluster feeding phase, there is also a shifting of the maternal hormone, the estrogen, the progesterone. They keep shifting to balance the body during the postpartum period. And in this adapting, this is a time when the mothers feel really exhausted, tired, emotionally weak, and this normally coincides with the cluster feeding. So what you can do it to make the cluster feeding go easily, this phase to pass smoothly. So first of all, feed on demand. Whenever the baby wants feed, you feed the baby. Second is keep skin to skin contact. Let the baby lie on you. So it's not a task to every time pick up the baby and feed him if he's feeding every 10 to 15 minutes. Third, make a small station that is a feeding station where you can hydrate yourself, you can enjoy reading your book during the feeding hours, you take a dry snack, dry fruits, laddus, whatever you like. Fourth, take help. Take help of your grandparents, your parents, your husband, because this is a phase where you require most. Fifth is rest. So please nap when the baby is taking a nap. That is the best time to get your rest. Track this pattern. Track the pattern of the cluster feeding. Normally they resolve within 48 hours and sometimes 72 hours. And as long the baby is gaining weight properly, active, taking feeds, passing urine, there is nothing to worry. Cluster feeding is nothing to worry. It is not a signal of any disease or something abnormal. It is a normal process that happens in the babies, and babies do exactly what they are wired for. This is where, how and when and how they improve your milk supply. And parents, reassure yourself, cluster feeding is a phase. It will definitely improve. The baby is just preparing your body to help you support in the further days which are going to come in future. Hope this video has helped you feel less alone and less exhausted. If you like the video, please subscribe.